Hello everyone, my name is Danny Trocchia, and today I'll be talking about the impact of COVID-19 on women in the United States and in Italy. The United States and Italy were two countries who were extremely affected by the coronavirus and continue to be affected by the coronavirus every day. As we all know, life has not been the same since the coronavirus has struck us, and the United States and Italy both recognize this, as death tolls and total number of COVID cases continue to rise every day in both countries. To start off, I would like to give a little introduction about COVID-19 in the United States. As we all know, COVID-19 has affected our daily lives in some way, shape, or form, whether it be a family member coming down with the virus or just our everyday lives being affected. In the United States, there has been over 28 million cases of COVID-19. Sex was available for 98% of those cases. So out of the 98%, 52.3% of those cases were females who have come down with the virus. That is over 11 million females, more than half of the cases that were able to be recorded by sex. These are huge numbers in the United States alone, let alone worldwide cases for coronavirus. Next, I would like to talk a little bit about the COVID-19 cases in Italy. Italy, having a smaller population than the United States, still has huge numbers for COVID-19. In Italy, there has been almost 3 million COVID-19 cases. To be exact, there has been 2,868,435 cases. Again, 51.6 of those cases were women who have been cursed with the COVID-19 virus. This is more than half of the cases of coronavirus, all women who have come down with the virus. In both Italy and the United States, more women than men have contracted the coronavirus. Coronavirus is deadly, as we all know. Some of us may have lost family members by it, and these numbers are huge, especially for the women who have been affected by the coronavirus. Now I will begin to discuss demographics of COVID-19 affecting women. Sex differences play a big role on how humans react to COVID-19 differently. This is because of the genetic makeup of male and female humans. Females have two X chromosomes, and males have a single X chromosome. X chromosomes improve the expression of key immune functions. Women having two, rather than men having one, help the expression of key immune functions and, in turn, help strengthen the immune response in women. This means that women have a more robust immune response to disease-causing viruses and bacteria. Women react to COVID-19 differently than men because of the more robust immune response they have. However, there is a downside to this robust immune response that women have. Women are now more susceptible to developing an autoimmune disease in which the body mistakenly identifies aspects of itself as an invader and the immune system attacks one's own body. In the world today, women may be at risk or exposure to the virus due to the occupational sex segregation that women go through every day. Women are more susceptible or prone to the virus because they disproportionately represent the frontline health workforce. Globally, women make up 70% of the health workforce and are more likely to be frontline health workers. They are also the majority of health facility service staff, such as cleaners, laundry, catering, and as such, they are more likely to be exposed to the virus. In some areas, women have less access to personal protective equipment or correctly sized equipment. This means they do not have the appropriate equipment to protect themselves from the virus fully, and are more susceptible because of this, especially that 70% of the health force workers are women. Without protective equipment to coronavirus, women are more susceptible to getting the virus. Still, despite these large numbers, women are not reflected in national, global decision making on the response to COVID-19. As for some of the demographics in Italy, it is still the same, with women representing more healthcare workers than men. In Italy, there were 10,657 healthcare workers who were infected by the coronavirus as of April 2020. 66% of those healthcare workers that were infected were women. This is two-thirds of healthcare workers affected by coronavirus, all women. 7,034 women compared to 3,624 men. As you can see, women are obviously disproportionately affected by the coronavirus, as they represent 70% of all frontline healthcare workers worldwide. Moving along to part 2, we begin to discuss demographics in countries. Starting with the United States. In the United States, the main reason women are more susceptible to contracting the coronavirus is because of how they disproportionately represent frontline healthcare workers. In the United States, a survey taken in 2018 recorded that 2,438,923 registered nurses are currently working in the United States. Out of the 2,438,923, 2,116,796 registered nurses are female, and only 322,127 are male. Obviously, this number is not evenly represented relative to female and male healthcare workers. There are a dramatic number of female registered nurses compared to male registered nurses. As stated in the previous slide, women clearly represent most of the healthcare workers in the United States, making up a total of 86% of healthcare workers in the United States. Even with the appropriate protective equipment, this takes a mental and physical toll on the minds and bodies of females across the country who are getting up every day to help prevent the virus from spreading and fight the virus with people who currently have contracted the coronavirus. Every day, women are going to work ready to fight this virus, and it has a dramatic impact on the way their lives are lived. Continuing on with part 2, beginning to discuss demographics in Italy, we now see that Italy's women are facing different struggles when it comes to COVID-19. This can be relative to contracting the virus itself, or mainly, as Italy is facing, being forced out of work. The gender employment gap in Italy is now the widest in Europe. COVID-19 has pushed many women out of work in Italy, many who have started their own businesses, whether it be practicing law or owning a retail market. Women are forced to shut down their work to stay home and take care of their families, especially those who have more than one child. On a list of 10 EU regions with the widest employment gender gaps, 7 regions on that list are from Italy. Some of those regions include Sicily, Abruzzo, and Calabria. I will now begin to discuss part 3, which is cultural similarities and differences among women. specifically in the United States. Some social, economic, or cultural issues disproportionately affecting women are as follows. Women are typically paid 82 cents for every dollar paid to men. This means that it will be less affordable for women that come down with the coronavirus to pay for health care that is necessary to fight the virus and to maintain a healthy lifestyle. 70% of restaurant servers are women. As we know, many restaurants have shut down with the quarantine periods involved in many countries around the world. However, if restaurants stay open, women are now more susceptible to getting the virus because they have to deal with many people that come into restaurants and want to be served. 66% of grocery store clerks are women. Grocery store clerks, typically cashiers, deal with money. Money is considered to be one of the dirtiest things that contains many germs from all over the world. Money can come in from every state in the United States or even across the globe. This means that women have to touch this money and are now faced with germs that can affect them and their health. 85% of home health care personal aides are women. Some people that these women may have to take care of can be very ill, many of which may even have the coronavirus. Again, this leaves women more susceptible to contracting the coronavirus and ultimately leading for them to be unhealthy and come down with the coronavirus. Continuing on with some more sociocultural issues that women deal with because of the coronavirus. 87,000 women were intentionally killed by an intimate partner in 2017. I state this number because coronavirus, as we all know, has set quarantine periods or stay-at-home orders in which nobody can leave their house, leaving women stuck with abusive, intimate partners or husbands. This has become a huge problem in households in which men abuse women as they are stuck at home and are forced to stay there because of the stay-at-home orders put in place by the United States government. There is a 30% increase of cases of domestic violence since COVID-19 has started. This number accurately represents how many women are currently dealing with abusive partners. More so, some women are afraid to speak up about problems like this. So there are many cases of domestic violence that go unreported, and many women who are still dealing with domestic violence and abusive partners every day because of these stay-at-home orders of the coronavirus standards. The US government has put these standards in to protect the health of many people in the United States. However, there is no way to get around domestic violence. It is also important to note that women are at significantly increased risk for intimate partner violence due to physical distancing measures, including emotional, financial, physical, and sexual violence. Continuing along with part 3, I will now discuss some sociocultural impacts in the country of Italy. Domestic violence remains a huge risk in Italy as well. However, because of the different culture, the impacts are a little bit different. Different from the United States, the number of cases dropped in Italy during the start of COVID-19. Before COVID-19, 1,157 domestic violence cases were reported. However, after the lockdown in Italy, only 652 cases were reported. That is a 55% drop in domestic violence cases since the start of the COVID-19 lockdown in Italy. Many governmental officials in Italy fear that the lockdown is silencing the victims in Italy. Because of the different cultural standards in Italy, many women are very afraid to speak out about their domestic violence issues. As we know, in the United States, there was a 30% increase in domestic violence cases reported, and in Italy now there is a 55% decrease in the cases reported. Clearly, there is a cultural difference in these two countries relating to domestic violence issues. Despite the negative impacts COVID-19 has struck Italy with, the Italian culture has tried to remain whole by working together while in their quarantine period. Many videos have surfaced on the internet of neighbors joining in song together with their neighbors from across the street or who live above or below them. The Italian culture has clearly come together in efforts to remain one through the pandemic. Moving on to part 4, which deals with ethical consideration and action related to the impact of COVID-19 on women. The question here is, what is being done to help aid women through this? As we know, in many hospitals and medical facilities, most of the staff are women. So, COVID-19 staffing provides an online resource to help hospitals understand and manage staffing needs. This may deal with COVID-19 tests or vaccines that we now are able to obtain daily. Also, allowing medical assistants and nurses to make contributions according to their abilities. This may include nurses or MAs taking verbal orders, performing computerized order entry, or doing medication reconciliation or assisting further with visit note documentation. This will alleviate some of the workload on physicians and APPs. This helps a lot, being that the workload for many women in the workforce and healthcare workforce have a lot to deal with already with the coronavirus. Continuing on with part 4, with ethical consideration and action, we look at some institutional policies put in place to help healthcare workers. Some institutional policies ensure that paid time off and sick days remain unaffected for employees for COVID-19 related illnesses. This means that healthcare workers that contract the COVID-19 virus and have a related illness will have no problem receiving their appropriate amount of money for their time off or sick days that they need. Another institutional policy put in place ensures that no out-of-pocket expenses for employees with COVID-19 related illnesses will happen. This means that all COVID-19 patients who are employees or are healthcare workers will not have to pay for their expenses for their medical attention. Lastly, we look at another policy that ensures physicians, medical students, and all members of the healthcare teams have access to appropriate behavioral, mental, and primary and specialty healthcare and addiction service. The last part of that, which is addiction service, is a big factor. This is because addiction numbers have also risen since the start of COVID-19, being that stay-at-home orders were in place and left more time for people to get addicted to drugs. There is no doubt that everyone across the world faces many struggles when it comes to the coronavirus. Women are especially affected by it and are more prone to contracting COVID-19 specifically because of their jobs. Women make up a huge majority of the frontline healthcare workers across the world and are faced with patients who have COVID-19, risking their own health and potentially their lives to save others. Women, who are typically underpaid, also face problems when it comes to paying for healthcare services related to COVID-19. Economic concerns for women across the world are a huge part of the many problems women face when it comes to COVID-19. Also, stay-at-home orders or quarantine periods affect women because of many domestic violence cases against women. Intimate partners or husbands who are out of work can tend to become violent when it comes to their wives. Unfortunately, this is a problem that women have to deal with in the world today, especially with the effects of COVID-19. Luckily, the COVID-19 virus is taking a turn downward and the future is looking bright for everyone, as a vaccine has now been developed. Without a doubt, COVID-19 has had a major impact on women's health and the way that they live their lives.